The broadcast is now starting. All attendees are in listen-only mode.
Welcome everyone to today's webinar on the Health Information Campaign Subcontracts, focusing on HIV/AIDS amongst Asian Americans, Native Hawaiians, and Pacific Islanders. My name is Henry Ocampo, Senior Program Analyst with the Office of Minority Health Resource Center and the project lead on this funding. Attendees will be on mute during this webinar. Questions and comments can be typed in the questions box and will be addressed after this presentation. This webinar will also be recorded and posted online, so you will each receive an email with the link to this online posting by tomorrow. Next slide, please. So for today's agenda, we'll be briefly going over the Office of Minority Health Center's background. We'll describe the Health Information Campaign's goals and objectives. We'll also go over the application process for this funding. We'll highlight deadlines and payment schedules, as well as how the applications will be reviewed by an external review committee. We'll end with a Q&A, which you can submit questions in the questions box. Next slide, please. So the Office of Minority Health Resource Center was established in 1987 by the Office of Minority Health at the Department of Health and Human Services as one of its initial efforts to respond to the recommendations of the Heckler Report. First authorized by statute in 1990, it was recently reauthorized along with OMH by the Patient Protection and Affordable Care Act of 2010. Next slide, please. So the Office of Minority Health Resource Center supports OMH through these following activities. So we help facilitate exchange of information regarding health and health promotion, preventive health services and education, facilitate access to such information. We assist in analysis of health issues and problems and provide technical assistance. Next slide, please. So now we're going to go down to the actual campaign itself. So as you may know, HIV funding targeting the Asian American, Native Hawaiian, Pacific Islander communities have been decreasing dramatically these recent years. And amongst the CDC's current PS 1502 HIV prevention funding for community-based organizations, only one agency out of 90 throughout the U.S. and territories was funded to target the Asian American, Native Hawaiian, Pacific Islander communities. So this led to a really significant decrease of agencies providing HIV services targeting the AANHPI communities. So this funding for this project will hopefully help supplement some of this need. And the funding was received from the Secretary's Minority AIDS Initiative funding. It's funded through 2018. So the goal is to implement an HIV/AIDS health information campaign that supports increased awareness of HIV/AIDS and increased HIV testing with referral to care of Asian Americans, Native Hawaiians, and Pacific Islanders. There will be a total of 10 subcontracts, up to $40,000 each subcontract. The project period for this will be from February 15th, 2017 through August 15th, 2018. The target populations or subgroups will include Asian Americans, Native Hawaiians, and Pacific Islanders. Eligible applicants can include community-based organizations, faith-based organizations, state, local, tribal governments, health departments, health ministries in the U.S. and the U.S. territories, and other healthcare entities. Next slide, please. So one of the things that when we put this together was trying to be as flexible as possible with the activities that you all would want to pursue. So when we talked about health information campaigns, these can include prevention education workshops, outreach, community events, HIV testing services, printed materials development, newspaper advertisements, posters, multimedia presentations, internet, radio campaigns, any of these activities that would help improve or increase HIV services that's being provided to the AANHPI communities in the U.S. and the U.S. territories. Project goals may include, but are not limited to, like increasing the number of people talking about HIV/AIDS, increase the number of media outlets covering HIV/AIDS related issues, reduce the silence and stigma associated with HIV/AIDS, increase number of people accessing HIV/AIDS care, services, and testing. Any and all materials that's developed through this subcontract will have to go through a review process by the Office of Minority Health Resource Center before printing and distribution. Also, all materials that's being developed must be 508 compliant. This means that anything posted on our websites must be accessible to people with disabilities, and the 508 compliance makes this possible. And this is and here's the link that talks about what 508 compliance is about. So if you have more questions, you can take a look at this link. Next slide, please. In addition, through this project, we're also helping to support the National API HIV Awareness Day on May 19th. So we'll be asking funded agencies to participate as an advisory committee for the National API HIV Awareness Day. We're also asking funded agencies to actively participate in the commemoration of the National API HIV Awareness Day on May 19th as well. Next slide. In regards to the sections of the application, if you had the opportunity to take a look at the application form, we really tried to simplify it as much as possible. So you'll have the one-pager for your agency contact information. There's a section on your agency capacity. This will include your agency's mission, a brief history of your organization, your agency's capacity to implement the program, as well as an outline of your current services that's being delivered, especially any HIV/AIDS programs. The needs section will explain your justification of the proposed HIV/AIDS project and identify your target ethnic or racial minority population to benefit from your project. Your proposal description will describe the proposed program or project. You'll describe your program, your project goals and objectives, specify your target audience, especially if it's going to be a subpopulation of AANHPI communities. Describe how your health information campaign will also reach the target audience. The monitoring and evaluation section will describe how your campaign will be monitored and evaluated, and please have have your measurable goals as stated in the proposal section will be the basis for this evaluation. The capacity building section will discuss how the agency plans to sustain operation after this one-time campaign has been completed. We're also asking for a timeline in the application. So this timeline of your proposed campaign, your agency will have up to August 15th, 2018 to complete this project. And you can also state your activities pretty much on a quarterly basis would be fine. As for budget, we're also asking that you provide a line item budget and budget justification for your proposed campaign. And just a reminder that federal funds cannot be used for food or refreshments in your activities. One of the things that we are definitely want to stress is that there will be a 12-page maximum for this application that excludes any attachments as well as the budget section of this application. So 12-page max. Next slide. Great. So in terms of time frame and payment schedules, the application is currently out. You'll have until Friday, January 6, 2017, to submit the applications directly to me by email. After that, we'll have an external review committee to review and provide recommendations for the top proposals to be funded. And if you are not planning on applying for this funding and is interested in helping to review applications, please contact me directly. We'll also provide some monetary stipends for your time. Campaigns are expected to start by February 15th, 2017, where we will release the initial payment of $25,000. Agencies are expected to submit quarterly reports, and then we'll release the second installment of $11,000 by October 2017. The final report will be submitted by August 15th, 2018, and the final and once that is submitted and approved, we'll have the final installment of the $4,000 to be released to you. Next slide. In regards to the application reviews, the proposal will be reviewed with a maximum of 100 points. The first factor with background and need will be 20 points. This will, if you can showcase the demonstrated knowledge of the problem at the local and regional level, significance and prevalence of HIV/AIDS in your targeted area, extent to which the applicant demonstrates access to the target population and whether it's well positioned and accepted within the population to be served, and your experience providing HIV prevention and testing services. Factor 2 is a program proposal, and that's a total of 35 points. And this will be in regards to appropriateness of proposed approach and specific activities for each objective, the degree to which the project design, proposed activities, and products to be developed are culturally and linguistically appropriate to your target audience, the logic and sequencing of your planned approaches as they relate to statement of need and to the objectives, the degree to which the goals and objectives are stated in measurable terms, experience in providing HIV prevention and testing services, and if you identified any partnerships with agencies for referrals for HIV testing. Factor 3 is the evaluation. That's a total of 25 points. So this will be looking at the appropriateness of proposed data collection plan, including demographic data to be collected on project participants, analysis and reporting procedures, the suitability of process, outcome, and impact measures, potential for proposed project to impact the HIV health status of the AANHPI communities. Factor 4 is the capacity building and sustainability section. That's a total of 20 points. And we'll be looking at the extent to which the applicant demonstrates ability to build capacity for your targeted region, and to the degree to which your agency has plans to sustain services after this one-time subcontract has been awarded. Another equity in geographical location and target populations may be considered in the final decision of these 10 subcontracts. So here's my direct contact information. I can be reached by phone at 510-797-7682 or by email at hocampo@minorityhealth.hhs.gov. Also, proposals should be sent by email to me directly. And so that's pretty much all I have to cover for this informational webinar. So we'll open up for questions if you have any. Oh, and one of the things too is that if you look at your handouts section on the webinar, you can also download the the web version, the Word version of the application, because the ones on the website is on PDF.
We have now we have 2 questions. Can you hear me?
Yeah, I can hear you now.
Okay, good. So our first question is, will applications be rejected if they exceed the 12-page maximum limit?
Yes. Yes, we will try to keep things as succinct as possible. So 12-page maximum for the application.
And the second question is, are there any other budget restrictions other than food and drink?
At this point, no. We're trying to be as flexible as possible in regards to the activities that you are proposing, as well as what would be covered by the 40,000. So depending on what your proposal will be, we'll make that determination. But otherwise, it's really at this point, food and refreshments are definitely restricted. But we can cover, you know, like outreach activities, staff time, yeah, outreach materials, testing supplies, pretty much whatever, trying to be as open as possible.
Another question, what are you looking for regarding the goal increasing the number of people talking about HIV/AIDS, and what types of measurements would be acceptable?
That would be one of the things that, especially with this funding, was to provide additional support for HIV services targeting the Asian American, Native Hawaiian, Pacific Islander communities. So we're trying to be as open and flexible as possible with regards to your project proposals. So it can be, like I mentioned before, you know, dealing with prevention education programs, testing services, social, some health media campaigns. It would depend on you and what you see as fit for your targeted population and targeted area.
All right, so the next question is a two-parter as well, which is, are we expected to host an event for National API in May? And should we include this event in the work plan?
Include some type of commemoration for the National API HIV Awareness Day. It can be hosting an event. It can also just be helping to provide support for some of the social marketing campaigns that's going to be pushed out for that day, some national campaigns that's going to be pushed out that day. So it doesn't have to be an event. It can also just be helping to help participate in the acknowledgement of and commemoration of that day.
Next question regarding the budget is, it says incentive is allowable, such like outreach work by community members?
Yes, incentives are fine.
All right. And another question, to clarify, did the slide say that the budget could only be 1.5 pages, 1.5 pages?
Those maximum of 12 pages for the application, excluding attachments as well as the budget section. And the numbers that's listed are the recommended page limits, but we're really looking more at this 12-page maximum for the application itself, excluding attachments and budgets.
Okay. Can costs associated with National API HIV/AIDS Awareness Day be budgeted in the grant proposal?
Yes.
Can we use funding to cover costs for a 5/19, I'm guessing 19th May event, such as the venue, but not including food?
Yes.
All right. And is there a limit to the number of attachments that can be included?
No limit.
Right.
No limit to attachments. Just the only thing that's hard is the 12-page maximum for the application itself.
Okay. Must our target population be specifically and only AANHPI? Apologies for the.
Yes, this funding is specifically for Asian Americans, Native Hawaiians, and Pacific Islanders, or any subgroups of those three populations.
Would a 6-month ramp-up time be allowable if we're considering a testing and anti-stigma media campaign?
6-month ramp-up time is fine. The project itself will have to end by August 15th, 2018.
That was our last question thus far. Do we have any other questions? Oh, here we go. Do we need to target all AANHPI subcategories, or can we choose?
You can choose any subcategories of the Asian American, Native Hawaiian, Pacific Islander communities. You don't have to cover all of them, just as long as they're within those 3 categories. It can be any subgroups as well.
All right. Do we have any further questions at this time? All right, so I'm getting no further questions, Henry. And if we do get any, if you hear that the webinar has ended and you just type in your question, the questions will be saved and we can answer them later. You can also, oh, here we go. So MSM is men who have sex with men, correct?
Yes.
Okay. So as I was saying, if any questions, if you have any further questions and you couldn't submit them here, you can submit them to Henry at his email there, or when you get the follow-up email, which will have a recording of this webinar, my email will be there as well, mbonnet@minorityhealth.hhs.gov, and you can submit any questions there as well, and I will make sure to pass them along to Henry. Any last words, Mr. Ocampo?
No, I said if for any additional questions, please contact me directly. Deadline for the application itself is Friday, January 6th. I know on our web page, on our website, we have the PDF version of the application, but on the handout section in this webinar, there's also the Word version of the application itself.
So if we have no further questions at this time, then we will be closing the webinar now, even though we're ending a little bit earlier than usual. Oh, here, one quick question. All right, go ahead. Okay, so it says, are letters of support and letters of commitment required?
No, it's not required. But if you'd like to include that as part of your attachments, that's more than welcome.
All right. So thank you very much, everyone, for coming. As we've said, oh, we keep getting more questions. Could you clarify why food and beverage are off limits?
That is one of the restrictions from receiving these grants, is that food and refreshments are not, we are not able to cover food and refreshments for any of our funding.
At this point, I'm almost scared of saying we're done.
I know I wish it was otherwise with the food and refreshments, because I know it's not culturally sensitive, especially for for our communities. But that's unfortunately dictated by the federal government.
Do we have any further questions? Okay, so it says, because this is a health information campaign, is priority given to these specific projects only?
No, we're really trying to provide as broad base as possible in regards to your project proposals. So whatever you see fit that would benefit the most for your targeted populations would be greatly appreciated. So so whatever you can fit in 40,000, if that's going to concentrate on more outreach services or workshop presentations, if you're going to concentrate more on testing services or developing an online more marketing campaign, that's really up to you to decide and make that proposal. So there's really no priority or on which activity is more appropriate, and that's up to you. I leave it all up to you.
What kinds of incentives are allowable?
Let's make that proposal, and then we can have a discussion around that.
Will you be providing a curriculum for workshops?
In regards to prevention education workshops, I would assume that that's something that you would, if that's one of the proposals that you are going to be pursuing, that you would have a curriculum in place. If there's a particular curriculum that you are looking to provide and would need assistance in getting more information on, then contact me afterwards, and I can see what we can do.
And okay, are gift card incentives allowable for focus group participation?
Gift cards are allowable as incentives.
And there's a question that just says care services. It must have been a follow-up from an earlier one. I'm guessing if care services are covered by the grant, I suppose?
This funding primarily focuses on prevention and testing, not necessarily on care and treatment for people living with HIV.
Okay. Are we allowed to pay an outside contractor to help with the campaign?
Yes, you're able to provide, to have subcontracts, provide consultants and contractors through this funding.
Should projects be new, or can funding enhance an existing project?
It can be both. It can be a new project that you're proposing, or it can definitely enhance some of your existing programs that you're currently providing. So it really is trying to be as wide and supportive as possible in regards to what you can do with $40,000.
Any further questions? All right, so we have no further questions. And here we go. Every time I say that, it's the magic words. So just to clarify, the description mentioned that the goal can be to increase access to people seeking HIV care services.
Yes, if it regards to outreach testing, but this funding does not. It's not really enough to provide treatment. To cover treatment. or case management services, but more for like the prevention, outreach, testing services.
Any further questions? I'm waiting here. I'm not going to say if no further questions. I knew it, just thinking about it. Will you fund communities that have the reach? Will you fund communities that have the reach to communities but not the experience with HIV education?
As long as the target population is targeting the Asian American, Native Hawaiians, or Pacific Islander communities. Was that last question clear?
No, here come a few more. One is, will you do site visits?
No, we don't have the budget for site visits at this point. But we'll try and maintain communication through phones and emails as much as possible. And I'm also just accessible as much as I can as well.
And the next question is, could you reiterate your expectations for increasing the number of people and media talking about HIV?
That's with your proposal. We're trying to, as I mentioned before, trying to be as wide in regards to the goals and objectives for this funding. So just trying to just put out examples of what you can propose, but it's not limited to any of these examples that I set forth. In regards to, for example, increase number of people talking about HIV, increased number of media outlets covering HIV/AIDS related issues, reducing silence and stigma associated with HIV/AIDS, increased number of people accessing HIV/AIDS care services and prevention services and testing.
And we have another question. I think the person is maybe asking for how many people we hope to increase. Is there a particular percentage of the community or X number of people who should be tested?
No, that would be up to your target region and your capacity as an organization to provide those services.
Is it required that we document success in service linkage?
Yes.
Any further questions? All right, so if there are no further questions at this point, then we will say goodbye again. Thank you very much for all of your questions and for taking the time to join us today. And we do apologize for the several speedy, oh, we're done, no more questions. And we do want to hear all of your questions. And as we said, if after this ends you still have questions, please send them in to Henry. His email is there on the screen for you. And if you've missed it somehow, just send me an email as well and I can send them along to him. So thank you very much to everyone again for coming today, for joining us today. If you have not had a chance to upload either the PDF version of the presentation or the Word document application form, we can certainly send that along to you as well. Henry, do you have any final words?
No, good luck. Let me know if you have any questions. Contact me directly through the phone number or email. And yeah, no, that should be it.
All right. Well, thank you very much, everyone, for coming today. Thank you, Henry, for joining us all the way out from the lovely, lovely Pacific. And everyone, have a great night and great rest of the day.